Karlsberg. I'm a principal and co-leader of our oncology dedicated practice at ZS Associates. I'm here today with Dr. Michael Bishop, Director of the Cellular Therapy and Stem Cell Transplant Program at the University of Chicago. Dr. Bishop, thanks for joining me today.
Thank you.
As you know, we've seen so much tremendous therapeutic activity with this new category of CAR T-cell therapies. We've seen remarkable results from therapies like Kymriah and Yescarta. And yet, even with all of that compelling promise, there are so many challenges that remain. Which of the challenges do you think, if overcome, would make the most difference in the patient experience with these CAR T therapies?
So the most important things to me is, I mean, as a person who treats patients with refractory diseases, the availability of Kymriah and Yescarta has completely changed our approach to this group of patients. But it's still not enough, because if you look at the degree of efficacy, it's still less than 50%. So the most important thing is, can we improve upon those results? The second thing is toxicity. And all of these have to be closely monitored. They can develop cytokine release syndrome, and they can develop neurotoxicities. And so being able to down-regulate those processes and improve the outcomes of patients would be the two major things that I see in regard to things clinically.
Dr. Bishop, you mentioned, as we look to the future and new therapies becoming available, I'm curious, what are the innovations in cellular therapy that you're most excited about over the next, say, 2 to 3 years?
Another form of therapy is allogeneic T cells. And again, the beauty of allogeneic T cells, they would choose some 19-year-old college girl who's a triathlon, and they pull out her immune cells, and they'd be beautiful. And these can be genetically modified, that they can be universally administered.
How soon do you think we'll see the idea of an off-the-shelf CAR T?
Well, we already are. So we are Selectus as a trial going. There's a number of companies that are doing it. Even the companies right now are thinking about maybe moving this to allogeneic T cells. And the beauty of allogeneic T cells, not only do you have a healthy T cell, you can choose the T cell population. That's where you can see the excitement in my eyes. I just think this is the very beginning.
If you look out, let's say, 10 years, what do you think the future holds broadly, not just for CAR Ts, but for the cellular therapy field
So I
in
think cellular therapy is going to be applied to almost every aspect of oncology. The targets on solid tumors are expressed on a number of normal tissues. So identifying those targets, that's one major barrier. But there is a way to get around this. So the other technology, T-cell receptors, and the majority of these tumors have neoantigens. And when I talk about neoantigens, they actually develop proteins that are specific for that tumor. And those can be identified. It's a laborious process at this point in time. But as we've seen for everything, over time, if we can get a very efficient way for the identification of neoantigens, because once you define a neoantigen, you can actually develop a T-cell receptor towards that neoantigen, then getting that production of the T-cell receptor then into a virus. And right now, that process is about 3 months. And again, with advanced solid tumors, that's very, very difficult. But that time is going to decrease as well. In combination with vaccinations, with checkpoint inhibitors, potentially even still traditional chemotherapy, and putting them all together, we're going to start making an impact on some of the solid tumors.
Well, Dr. Bishop, thank you for your commentary. As you can see, there are so many changes happening in the field of cell and gene therapy. Today, Dr. Bishop's illuminated many of the exciting advances happening for patients with DLBCL, multiple myeloma, and we certainly hope the future holds hope for more patients, more personalized medicine, moving into the solid tumors and far beyond. Thanks for joining us.
Thank you,
Dr. Bishop.
Appreciate it.